New coronavirus cases are falling in parts of the United States, hit hardest by the fast-spreading Omicron variant. According to an analysis of public health data, offering an early indication the virus might once again be in retreat. COVID-19 infections nationally are down by 12% in the last 7 days compared with the prior 7, the analysis found. Cases have decreased in states such as New York, New Jersey, Pennsylvania, and Maryland, plus Washington, D.C. That's prompted some health officials to strike a cautiously optimist tone on the trajectory of the pandemic. Dr. Anthony Fauci, the nation's top infectious disease official, told MSNBC on Monday that it's reached its peak in certain regions of the country. Wafaa El-Sadr, a professor of epidemiology and medicine at Columbia University, said she expects the drop in cases to go from east to west across the US.
I think the peaks and the falling and the drop in cases is going to go in waves from east to west largely, because that's how Omicron did hit this country in particular. So I think overall, because of the large numbers of populations on the northeast and the east coast, is that we influence very much what happens in terms of the numbers in the country overall. So I would predict that we will see the peak in the United States. I think we're beginning to see already peaking in the United States overall. But does that mean that we've peaked everywhere? The answer is no. That will be on a rolling basis across the country. Certainly at this point, in many places around the world that already have experienced the Omicron surge, we are beginning to see very abrupt decrease in numbers of cases. It doesn't mean it's happening everywhere, because the wave of Omicron reached certain parts of the country before other parts, and certain countries before other countries. So I think it's a matter of time as countries go through the enormous surge in numbers of cases of Omicron, and then once they saturate the population, then I anticipate that in all of these places we'll see a similar, very rapid drop in numbers of cases.
The analysis shows that nationally hospitalizations are now under 147,000 compared with a peak of 152,746 on January 20. But in many parts of the US, infections continue to increase. And in some states, including North Carolina and Arkansas, COVID-19 hospitalizations are still setting records.
I think it's a little bit premature to now change abruptly behaviors. I think what we should do is continue to do what makes sense. And by that I mean, obviously, is wearing masks indoors in any public setting. That's very important. As well as, using the testing strategically, not to just get tested for the sake of getting tested if you don't have any symptoms. To think about that only in the context if somebody develops symptoms, to then use the tests that are available.
The death toll from the Omicron variant continues to rise. Coronavirus deaths hit an 11-month high on Sunday, January 23, climbing 11% in the past week when compared to the prior week. COVID-19 fatalities are a lagging indicator, meaning their numbers usually rise a few weeks after new cases and hospitalizations. On Monday, January 24, the head of the World Health Organization, WHO, warned that it was dangerous to assume Omicron would herald the end of COVID-19's most acute phase, and exhorted nations to stay focused to beat the pandemic.
I think for many people there's been this sense of almost an anticipation or a hope that there'll be one day when COVID will be completely gone. That they'll wake up and say, okay, today there's no more COVID, and yesterday there was COVID. This is very, very unlikely. It's very unlikely that we're going to be able to eliminate or even eradicate this virus. And therefore the future, I think, is really all about how do we live with COVID, but also how do we minimize the risk, and particularly for the most vulnerable, how to protect them from COVID and its many complications. So I'm hopeful that the silver lining from the terrible experience with COVID-19 is that we put in place what we know is needed. We need to strengthen our public health systems. That's critically important, so they're ready to be able to address any major health threat.
The Omicron death toll has now surpassed the height of deaths caused by the more severe Delta variant, when the 7-day average peaked at 2,078 on September 23 last year. An average of 2,200 people a day, mostly unvaccinated, are now dying due to Omicron. That is still below the peak of 3,300 lives lost a day during the surge in January 2021, as vaccines were just being rolled out.